Well, a warm welcome to this talk. Now, we do pride ourselves on this channel as being family friendly, but if you're a parent, you may want to review the content of this video first before allowing younger people and children to watch. This video doesn't contain anything interesting or educational either. But it is quite interesting. Now, Dr. Malhotra, who's a friend of this channel, sent me this link from a popular video sharing app, and this is entirely artificial intelligence generated. This is not me. I assure you this is not me. But I just felt that I really wanted to share this with you, partly because it's laughable, because it's so stupid. And I never do endorsements anyway, as you'll know. I would never advise you taking anything. We only provide educational material. But also, is there something really potentially sinister here as the artificial intelligence develops? Watch this one and then see what you think. And then I'll show another one from Dr. Malhotra as well.
Do you go to bed too early? Then listen carefully. I've been a doctor for 43 years and many men come to see me with the problem of premature ejaculation or impotence. In fact, 1 in 3 men over 40 has this problem. A simple natural product that I often recommend is used for centuries to treat impotence. It's even known as Indian Viagra. It naturally increases your testosterone levels and eliminates unpleasant problems in bed. I've given it to some of my patients and they've experienced significant differences after just 1 or 2 weeks of taking it. If you want to try, I've put the link to the one I recommend in my profile.
Well, there you go. I'm not really quite sure whether to laugh or cry, really. Probably a bit of both. Just to clarify, that was not me. That was artificial intelligence that was somehow managed to move my voice and put in words in my mouth. If you know me, you can clearly tell that wasn't my voice. To clarify as well, I haven't been a doctor for 43 years. I was a nurse, an academic, a teacher, a lecturer, a writer and a researcher. And I would have thought, it sounds like on that video as well, they're confusing premature ejaculation with impotence. And I would have thought they're mutually exclusive diagnoses, but that's just a few random thoughts on that. So let me know what you think. Interesting. Wasn't me. I never make recommendations and never do product placements. So if you do hear me doing a recommendation or a product placement, it won't be me. Or if anything changes, I'll let you know. But so far, at the moment, it certainly isn't. Now, there's an even more amusing clip where they've done an artificial intelligence mock-up of Dr. Malhotra. Let's listen to that, then we'll give a bit of feedback on that. This one's slightly more amusing because it's utterly preposterous.
3 signs your pencil isn't producing enough testosterone. Number 1, you're tired all the time. Number 2, you don't wake up with a boner. Number 3, you feel like a slob all the time. So how do you fix this? There's a supplement known as the destroyer of all weaknesses. For centuries, it's been used as a fuel source for humans as it massively increases energy because of the 87 vital minerals it contains, while doubling testosterone levels in men. Only 1 dose of it every day for a week may completely clear your skin as it kills the bacteria which allows acne to grow. After 2 weeks, you might not be able to recognize yourself anymore as your stress and anxiety have dropped because of your stress hormone cortisol going down. This supplement is called. The only problem is that it is very rare and can only be found in the Himalayan mountains. So what I advise my patients is to buy third-party tested to avoid fake ones. Personally, I get mine from. The link is in my bio.
Well, you have to say that one was a bit funny, wasn't it? Now, clearly I've taken out the names of the preparation that they're discussing there. I did get a see Malhotra's permission before sharing this. Of course, he thought it might be somewhat amusing and enlightening for you. There's some inaccuracies there as well, to be quite honest. I mean, for example, that reference to the skeletal system, Dr. Malhotra is English, of course, is completely English. So he wouldn't use an American reference to the skeletal system in his terminology, I don't think. And also, The idea that pencils produce testosterone is completely inaccurate. It's utterly ludicrous. I mean, if by some miracle of spontaneous generation of complex molecules, testosterone was produced in a pencil, then how would it get into the circulatory system? It would have to come out, somehow jump through the air to get into the blood. So the idea that pencils produce testosterone is just completely, utterly ridiculous. Now, I couldn't quite remember where testosterone was produced myself, so I did write a book on this a few years ago, Campbell's Physiology Notes. I will put the link in. You can download it free, high resolution PDF. You can also download for the same price this one, Campbell's Pathophysiology Notes, and this one is crammed full of information about human pain, suffering, and death. But of course, the whole point is to prevent human pain, suffering, and death by our knowledge of it. Anyway, getting back to the point, I'm just to refresh my memory. I'm just going to read the bit here on from this book on testicular hormones. So we see that we'll see where testosterone is produced. The testes are located in the scrotal sac and produce testosterone. So we see that testosterone is produced by the testes, not by pencils. Whoever thinks that testosterone is produced in pencils simply doesn't know what they're talking about. That's the testes, secrete the hormone testosterone, which is the principal androgenic male hormone. Like estrogen and progesterone, testosterone is a steroid-type hormone synthesized from cholesterol. Testosterone is produced by the interstitial cells of Leydig, which lie scattered between the sperm-producing tubules. Now, clearly that wasn't Dr. Malhotra, because Dr. Malhotra would know where testosterone was produced, because as a consultant physician they learn this kind of stuff. The idea, he would know it's not produced in pencils. So interstitial cells of Leydig, which lie scattered between the sperm producing tubules. Secretion of testosterone is stimulated by LH, luteinizing hormone. It is increasing levels of testosterone which stimulate puberty in boys. The hormone causes development of external genitalia and stimulates sperm production. By promoting protein synthesis, testosterone stimulates growth in bones and muscles. That's why boys bulk out, of course, in puberty and become more muscular. It also leads to male secondary sexual characteristics such as deepening of the voice and growth of facial hair. Testosterone also promotes male libido and aggression. So it can be a blinking nuisance sometimes, that's for sure. If a boy is castrated before puberty, which we don't recommend on this channel, but if a boy is castrated before puberty, most of these developmental changes do not occur, nor do castrated males demonstrate male pattern baldness. I'll leave you to draw your own conclusions. But for now, I thought that was an interesting warning on the dangers of artificial intelligence. If it was a bit smarter, this would be a deep fake, but I don't think it's quite smart enough to be a deep fake. But seriously, interesting times. What more can I say? Let me know what you think. And we'll leave it there for today. But some silliness, but a serious point, I think. So thank you for watching.